Hi, welcome to Vitalize Health Partners, where our goal is to educate, give you the best information so you can make really educated decisions when you go see your doctor or healthcare provider. Health coach Erin and I, Dr. Andrew O'Connor, have made it our mission to educate and inform. And that way, you are ready to see your doctor. Feel free to visit our website, vitalizehealthpartners.com, where we offer one-to-one consultations that include two of us. The first one is with our health coach, Erin, and then a follow-up call for no extra charge with me, Dr. Andrew O'Connor, to answer all your questions about your medications or something your doctor told you and you don't understand, or literally everything. We're not acting as your healthcare provider. We're just solely educating. Okay, so what we're going to talk about now is, are you the kind of person that gets high blood pressure when you go into your doctor's office and you just don't know how to fix that? It's called white coat syndrome. Well, I have some tips to get you ready to see your doctor so your blood pressure doesn't go through the roof. So, we're going to focus on relaxation before the visit. So, it's a really good idea if you schedule your visit, say at 10 a.m., 11 a.m., and you can wake up early, take a morning walk. It can be, if you're able to, if you are able to do this, take a short morning walk just to get all the nervous jitters out. Do you know one of the best recommendations for dealing with anxiety, and it's getting worse and we don't want someone to have a panic attack, is activity. Activity and exercise is the best way to combat certain types of anxiety. So taking a short walk, it prompts you to breathe hard, because we love doing breathing exercises like taking, I'll do it now, 10 deep breaths. We call them yoga breaths. 10 deep breaths in a span. I don't know, it could take you 5 minutes to do that. Don't rush through it. You don't need to get lightheaded. But when you take a walk, it forces you to do some deep breathing. Of course, you probably know this, but listen to some calm music while you're in the car on the way to the appointment or at home when you're getting ready. A lot of us, we just don't have time to flip on the music. Well, put it on your phone. Yeah, just have some calm music that you enjoy. Relaxing you. I love listening to ocean waves and just birds chirping, wind chimes, all that are really relaxing. And you can even keep a journal. I talk about this on my next video of how to get better healthcare. One of them is bringing a journal to take notes. Well, you can use this same journal to jot down your thoughts. What are you worried about at your appointment? Because if you get it out of your brain and into the notebook, you're not going to focus on it anymore. You're just like dumping it out into this journal. And now it's off your mind and into this journal. It's a really good idea. You can also try a decaffeinated herbal tea or a decaffeinated drink of your choice. Warm it up, sip on it before you get in the car to go on your visit. It just forces you to sit and calm down. That way you're not running around the house. Hey, and regularly participating in things like, I don't know, meditation, Tai Chi, yoga, anything. And, on YouTube, of course, there's lots of videos about like 5-minute meditation, like just something to walk you through. They go head to toe, like concentrate on your head, release, any stress in your eyebrows, close your eyes. Like they'll walk you through head to toe. It's a really good thing to do before a doctor's appointment. And you can even be doing that in headphones in the doctor's waiting room, like having them go through that guided meditation while you're sitting there. Now, of course, there's really nice herbal remedies like lotions, essential oils, sprays, things like that. If you're not allergic to them, like a little bit of lavender, spray it on a tissue. You have it in your purse. So, in the waiting room, you can take a little sniff of that, listen to your calming meditation. And I tell you what, because what I do when patients come to my office, because I do have the luxury of time, they can stay with me for a long time. I may have them sit in another room that I have and they're reading a book or they're listening to music before they come in. And when they're in my office, I have them laying down and we may be discussing something like the last vacation they were just on or how their dog is doing. And once they're relaxed and breathing, then I take their blood pressure. I know not all doctors' offices can do that, but if you can do some of those things, it may help the white coat syndrome that everyone is afraid of. And what's really important, if you're having anxiety that it's only happening with one provider, maybe there's something going on in that doctor-patient relationship or provider-patient relationship that isn't based on honesty. So, for the most part, your provider is there to help you and to protect your health, to help your well-being, to help you get to the best you that you can. For the most part, I'm hoping most providers are doing that. I understand healthcare is a little bit broken, and that's why we started this channel. Part of giving health information and education out there to make your patient experiences better with your doctor. But if you haven't been honest with your doctor, maybe now is the time to be honest. And if you feel like your doctor's not being honest with you, you can tell your doctor, like, look, I can handle this. Tell me the prognosis. Tell me what I'm really dealing with here. Because a lot of doctors are afraid to say the bold, honest truth because they're afraid the patient won't come back or the patient's going to break down or melt down or start yelling. If honesty is that, maybe just let your doctor know, like, I can handle it. Or, doctor, I don't feel like you're telling me everything. Or, doctor, I'm sorry, I haven't told you everything. Honesty is key, okay? And I know in the last few years, a lot of, I'm not going to say necessarily doctors. I'm sure there's some providers, but the healthcare industry, I don't think has always been honest in the last few years with patients. And it's important that we get that integrity back, and everyone needs to be honest, right? And if you're a healthcare provider watching this, if you don't know something about a medication or an injectable, tell your patient, you know what? I don't know, but I'm going to look into this for you. And we'll talk about it on your next visit. Or, sometimes I'll just email my patient or give them a follow-up phone call on something I'm looking into. I guarantee your patient will respect that versus if there's a new medication on the market and you're like, well, everyone's recommending it, so you should just take it. Well, is that being honest? Maybe not. So I will just remind patients and providers alike, honesty goes a long way. So again, if you have questions and you want a one-to-one consult with myself, Dr. Andrea O'Connor, and health coach Erin, because the one visit that you schedule includes both of us. You get a consult with both of us for that one fee. Again, we're not acting as your doctor or your provider, but we're answering questions that you still may be confused about on the healthcare treatment, the medication, the diagnosis that you're dealing with right now. Or maybe there's doctors you don't know exist or referrals that you are not familiar with, or there are new medications and treatment strategies that your doctor's not familiar with that I hope we can talk about this channel. But if not, you can schedule that one-to-one consult. You can see our website at vitalizehealthpartners.com. Thank you for being here.